Let's start. Bismillahirrahmanirrahim. So we will start with Cushing syndrome. So as I was telling you, this is a simple topic, and at the same time, this is a complex one. Okay, we know everything, but still confusion with the questions. Okay, so this concept should be very clear to all. Specifically, how the questions are coming from the sign symptoms. You need to diagnose it, and also you need to understand the protocol of the investigation for part one. For part one, actually, up to investigation, that is enough for you. Because treatment for Cushing, you don't need to know. Because this is just treat the causes. Whatever the causes is there for Cushing, you will treat it. So treatment part, it's not for you guys. So for part one, what you should know first of all. So first of all, you have to know obviously the sign symptoms, how it will present, and obviously the causes. What could be the causes? Just a minute. Sorry for the interruption. So you have to know about the sign symptoms and the causes and the investigation. Specifically, people are doing wrong in the investigation part. This is the problem with the part one questions. Okay. So you need to understand the investigation very well. So one by one, we will do. Come to our first thing, that what is actually Cushing. I think all of you have already a known topic, this one, that what is Cushing. And if you have already listened to our first lecture from our website, you know the idea of GFR to SED, right? GFR, this is about the adrenal cortex. What is adrenal? Adrenal gland, right? So in your abdomen, above the kidney, there are two glands which are known as the adrenal. That means adjuvant to the renal. Okay, so this adrenal gland, it has two parts, cortex and medulla. We have already discussed in our first lecture in website very well, very clearly with pictures and everything. If you go to the first lecture, you will know that. Just I want to summarize when I'm starting. So this adrenal cortex has three parts, specifically like outer, middle, and inner, from where they are secreting some hormones. Okay, so the mnemonics is GFR and SED. This is a very popular mnemonic. So this is the zona glomerulosa, from where you will find there is secretion of aldosterone. A for aldosterone, right? Can anyone tell me fasciculata? What we are secreting from fasciculata?
Cortisol.
Very good, cortisol. And from reticulosa, DH, dihydroepiandrosterone, HEA, right? So today we are talking about this fasciculata part. Please stop the videos. So this fasciculata, from where this cortisol is what? This is a kind of glucocorticoid. Why cortisol they are telling? This is the mostly secreting hormone who is responsible more. Okay, so most of the corticosteroid, like if you tell dexamethasone, betamethasone,
Okay.
cortisol, they all have like dual type of action. They can work as glucocorticoid and also can work as a mineralocorticoid. Okay, so specifically, actually, the thing is that whenever this fasciculata portion, from where this cortisol level or glucocorticoid level is high, that time the syndrome we are facing, that is Cushing syndrome. Clear? So the main fact is that we will have glucocorticoid level high, mostly cortisol level. This is the most abundant we are getting. So these things, when it is high, that is our Cushing syndrome. So this is the main fact. That's how we understand that this is the Cushing syndrome. So let's just have a look. So this is our GFR and SED, as I was telling you, right? This is our GFR and acidity. So this fasciculata is our today's study topic. So glucocorticoid cortisol, whenever this is increased, that is what we are telling Cushing syndrome. Okay. Now, come with the, I was telling you that there are some like dexamethasone, betamethasone, these are also glucocorticoid, not only cortisol. Why I'm telling this? This will need in your investigation part. So you need to understand that. You need to understand that this prednisolone, dexamethasone, betamethasone, they have also very high glucocorticoid activity. They have also to some extent mineralocorticoid activity, but mainly they have the predominant glucocorticoid activity. So from here, you just remember maximum, which one I want you to remember, dexamethasone. So dexamethasone, they are having high glucocorticoid activity. Okay, so this one and cortisol is like same, like, right? They are both like same, glucocorticoid, their properties are same. Why you need to understand this? I will ask you. When I will go to the investigation part, I will again ask you. Okay, so in a nutshell, what I want to make you understand, the dexamethasone having glucocorticoid activity. It is a kind of glucocorticoid hormone, though it has to little extent mineralocorticoid activity also. Okay, some properties which are mimicking. So anyway, we finish this one. Now come Cushing syndrome. I was telling you how they will present you, right? This is from MBBS level. We are talking about this one. So many symptoms are there. In a nutshell, in a very structured way, I want you to remember. Okay. So first of all,